So this is Chester. This will be where you're doing your central line dressing change, okay guys? Not this one, not that one, but this one, okay? As you see, it has a transparent dressing and something called a bio patch, okay? Now this is a fake one. We make these in-house because a real bio patch costs hundreds of dollars for one. Okay, so that's why we make them in-house. But in real life, they'll come in an individual package, kind of like the setup we have here, and you're gonna drop it into your sterile field, okay? So just like with your IV, your dressing change kits can change from unit to unit, hospital to hospital. So when you first get there, you need to look and say, okay, what do I have? I got my drape, I got some mask in here, I got my gloves, my alcohol, my chlor prep. You gotta look at all the things you're gonna need for this process, okay? So you always check, okay, only thing I'm missing looks like is my bio patch. Sometimes the kit come with them, sometimes they don't, okay? You're gonna learn specifically what your facility wants from you, because sometimes they don't have a bio patch, they have the transparent dressing with the impregnated chlor prep in it, so you may use that instead. So it's gonna look a little bit different, but this is kind of like generally how you do a central line dressing change, okay? Also, again, for our purposes, we are doing this to see how well you guys handle a sterile field, okay? So when it's time for you to go to your next station in the lab, you're gonna do the same process. Knock on the door, say, hi, my name is Symphony, I'm your nurse today, and yep, come on over. And say, because you gotta see, like, hey, let's prove I'm washing my hands. And say, hey, I need to do a central line dressing change for you, is now a good time? They say, oh no, I was just about to eat my dinner. I mean, it's okay, I'll come back, okay? So again, consent and support, so get your consent. You wanna confirm to see if they have an allergy and their full name and date of birth. Say, hey, can you tell me your full name and date of birth? Whoever the instructor is in the room with you will answer on their behalf, and then you say, hey, do you have any allergies? We'll give you an answer, okay? Now you can proceed, okay? So again, making sure you have everything that you need, and of course, taking it off is clean, okay, not sterile, okay? So obviously you have to wear gloves. There's no not wearing gloves for this process. So you put your gloves on, right? So I have a lot of tape here, so I'm just gonna take my tape off. Now, in real life, this stuff is truly sticky. A good thing to do if you can't get the sides to come off first, you see where this entry point is with the line, start at the line and get some separation and then move to one side or another. And this part right here does hurt a lot of people because it's so sticky, so you may need to get an alcohol wipe and wipe as you go or saturate it a little bit, just so it's not pulling at their skin. Again, your older population, their skin tears really easily, and this is something that tears their skin all the time. All right, so I have most of it off, right? Now, I'm gonna see where, well, that was easy. My bio patch has a little slit in it. Make sure I take it off. All right, and then we're gonna throw it in the trash, okay? So I don't wanna see his, right? I don't wanna see that, just throw it in the trash. All right, so now I have that off, okay? I wanna see if you guys caught something. What did I miss before I did that? I do this with every group. Usually one person can tell me.
You have the person that I will take
Consent form.
I did ask consent. Think about infection control. I'm wearing gloves. Mask. Mask. Alright, so before you take this off, you say you should have a mask on. And then you put a mask on your patient and you ask them to turn their head in the opposite way.
Yeah.
Okay? Usually most groups are like, hey, didn't you forget something? But I always ask once I get to this point. So your patient's head will be this way, right? It's now exposed, so now I can clean, right? So now I can take this off. I'm gonna clean my hands again. I don't need this anymore. Got my tray. So I'm gonna open it. Now, everything is encased in your field. Okay? 'Cause a lot of times I see, I don't know what to do. Take it out. You don't need this anymore. Okay? In trash. Right? Now remember from nursing school, right? How do we open sterile fields? Away. Correct. So I have a little tab right here. I'm gonna pull it out. If it'll come out, there we go. in a way, okay? So just the same thing in nursing school. What messes you guys up is you're a little too gentle, right? So you get it and you're like this. Oh, this keeps falling. I don't know what to do, right? You gotta like force it to stay open. So remember the 1 inch rule, right? When you touch something. So typically for most people, that's your thumb, right? So as long as you exceed that into the sterile field, you're good. It's not considered broken, okay? So as I'm opening this, I have to use a little bit of purpose. So when you guys get to the flaps, straighten them out, okay? Because when you don't, it keeps falling out and you get flustered. You're like, oh my gosh, it keeps falling. So straighten them out. And so I have this, my 1 inch, come out. And so when you pull just one direction, the other folds will fall in, okay? Stabilize 2, right, at a time. I'm gonna come over here, stabilize these, 2 at a time. Now I have a flat surface, okay? Again, you guys get so flustered, you're like, oh my gosh, everything's falling in, I don't know what to do. So take your time. This usually takes about 10 to 15 minutes, but you guys feel like it's taking an hour just by opening it up, right? And you're trying to rush through it, so don't worry about that. Now you see this particular packet has a mask in it, okay? So, okay, that's why it's on top, okay? Now, we don't use sterile forceps to reach into our sterile field, okay? We just do it sterilely, okay? So there's no such thing as like, oh, I'm gonna grab these sterile forceps and I'm gonna pick this up. Unless you're working in OR, you won't have access to that. So I can just grab the corner. I'm not touching anything but this. But uh-oh, I got some stuff on here. And this is what you guys wanna do. It's not coming off. And then your wrist dropping this back into your sterile field. So this is what I'm saying when I need you guys to think sterilely. I'm gonna come underneath here, right? And then just take it off. I didn't break sterility, okay? Unless like my arm touched something, but got it off sterilely, okay? I don't wanna see this. I had one nurse do this. Like, that's not, it's still broken sterility, so now I have, excuse me, you're gonna have to create space. In a lab, you'll have more space. So I don't want this. Okay, thank you. Okay, it happens at least three times a group. Okay, it's just like you do all that work to get it out sterilely, and then you're like, exactly. That's exactly what I say. Like that just defeated the purpose. So, good catch. So when you take them out, off to the side, and kind of think about you're gonna need to open this up. So move it over if you need to. Okay. In the lab, you'll have this whole section with Chester on this side and all your materials, and then there's another table on the other side. So I encourage you just to move over to the other side of Chester. And it tells you exactly how to do it, okay? All right, I see, like, ma'am, how do I open this? Do I rip it, ma'am? I had a nurse ask me, do I rip it open, ma'am? No. Take the flaps down. Again, this is practicing a 1 inch rule, right? And with this one, you're really gonna have to come up a little bit. When you don't straighten it out a little bit more, it's gonna fall back. And technically speaking, that is a broken sterile field, okay? Just take your time and straighten it out a little bit, okay? So, you always start with your dominant hand, right? Dominant hand. You clean part inside the cuff, okay? So I'm gonna take this cuff, right? And just take your time. I have small hands, so it's easy for me, okay? Some of you guys with normal size hands, you're gonna struggle a little bit, but take your time, because you're gonna be like, right? And I don't wanna see broken sterility, so just take your time and get it on there, okay? Now, what I'm not gonna do is this, right? I see it often. Take your time. Sterile to sterile. Remember, consider this clean or dirty. So sterile to sterile. I'm gonna open up this cuff. Bring it high. Because when you guys stay down here, you're touching, I see this all the time, right? So bring it up a little high. And I have it stretched so I don't touch. Let it go, okay? I can fix the outside, that's good to go. All right, it doesn't need to be perfect because you guys are like risk breaking sterility to try to get this perfect. It's not necessary, okay? But now I have my gloves on, okay? This is technically still sterile, but it's in my way and I don't need it. So as a true ER nurse, just drop it on the floor, okay? I clean up after, all right? So now I can touch inside my sterile field. I always put all my stuff the way I need it, okay? All right. So I have my alcohol swab, okay? What I don't want to see is, I'm gonna take my alcohol swab. This is gauze, all right? You have everything you need. Here's your alcohol swab, okay? This is your chloroprep, just like the one we use for the IV, okay? In the video that Liz should have sent you, it should be 2 of these, okay? But again, this is a training kit, all right? So you can simulate and say, once I'm done with my first one, I'm gonna simulate like this is my second one and clean the line, okay? So it's okay to verbalize that. In real life, you'll always have 2, but the training kits don't come with 2 for supply reasons, okay? Now, like many nurses, I forgot to do something and nobody caught me. What did I forget to do? There you go. So at this point, a lot of times you guys reach this stage, you're like, what do I do? Oh my gosh. In real life, you're gonna call for help, right? Or you're gonna have another set of gloves, right? I'm gonna be there with you and I'm gonna say, okay, what are you supposed to do with that? And you're gonna tell me, I should have dropped it in my sterile tube, right? What I'm looking for when you're not sterile, don't just lazily open this up and you're touching this part, right? Because you won't have sterile gloves on, right? It's a clean drop. So that's off to the side, and then do a little wiggle, okay? But no reaching inside to grab it, right? It is sterile, so you drop it on a sterile field, okay? And then you would throw that in the trash. So bio patches, have you guys been exposed to bio patches? Okay. It's a little patch that looks identical to this almost. This white part is simulating a sponge. The sponge is impregnated with CHG, okay? So it's for infection control. The blue part is simulating the cover, because if you try to put a transparent dressing over something wet, it won't stick. So the blue part keeps the top portion dry. Does that make sense? So you can have a good seal. So that's what your bio patch is for, okay? It is for infection control, all right? Not stability, but only infection control, okay? So get as close as you need with your sterile field. In practice, I don't like to see nurses do that. Although it is sterile, if it's considered trash, just keep it away from your field, right? Throw it off to the side or in the trash. In your packets at your facility, you should have about 3 of these, okay? But again, this is training, so we only have 1. It is wet. And a lot of times you guys are like, right? So it is wet, so when you take it out, be careful, and you can drop it in the trash, okay? Now, how can I do this without breaking sterility for either glove? Any thoughts?
Consider your left hand on sterile.
What if I want to keep it sterile? How do I do that? You're pointing. You're pointing at gauze. Okay. You can most certainly consider this unsterile and do what you need to do. You just kind of make it a little bit harder at the end, right? But you can still get it done. Okay. But the easiest way is just to stay as sterile as long as you can, right? So you can either use this one or you can use a small one, right? And you just use the gauze to protect this hand, right? So I know I need to manipulate the line, so I'm gonna place this, right? And I have not broken sterility, okay? You're gonna clean first with alcohol, always. You obviously start at the insertion site, right? Just put your head down. And then you just go all the way out. And again, in real life, you have 3 of these because this is very small. But all I wanna see, put your back down. You started at the inside and you're working in circular motion. What I don't wanna see is you guys do this. It's all the time, okay? So pick up the line and you start in small circles and then you just get wider. You're not truly timed for this, and the time you think you need is not as long, okay? So take your time, I don't prep. Okay, so like I said, your real kits will have 2 of these. Your first one, you're gonna take it and break it, invert, so you can wet your sponge. So I squeeze the wings, and there is fluid in this little capsule, and now it's released into the sponge. Give it a little shake, right? I'm gonna pick up my line again, right, and do the exact same thing. I'm going to start at the insertion site and scrub. With your alcohol swabs, you saw me wiping, right? With this sponge, remember, scrub. So I want back and forth motion in a circular manner. And you see I'm kind of going further out, right, as I clean the skin. When you're cleaning with these, think about where your tegaderm is going to cover, okay? It makes no sense to just clean this little part and none of this is clean, but you're going to place tape over all of that, right? clean wherever your tegaderm is gonna cover, and maybe a little bit more, just to make sure, okay? Now, you're supposed to have a second one, so you'll say, okay, I cleaned the skin. Now I'm gonna grab my second one. You're still gonna have this one in your hand. And now you have to clean the line, okay? So that means this has to move, okay? So you do change caps when you do this procedure in the hospital. For our purposes, you will not do that, okay? So you're gonna have to carefully, what you can do is take this, stabilize it. I'm gonna pick up the gauze, because my line is a little sticky, as you guys see, right? Take your time. And now that's dirty, but still the top portion of this is still sterile, okay? So now I'm gonna take my second one and work from this part, right? And you gotta scrub, because I see this all the time. Like you're trying to color in the lines. What I wanna see is, I need a good scrub. Come up this line. I don't wanna see you starting here and going towards the one, okay? So center, get it. It's wet, so saturate, right? Get a good scrub and scrub up, okay? Now, we typically inspect before we get our supplies, so if you see that the line is real dirty, you can always grab extra of these. They come in their own package if you need more. So Chester's been around for some time, so this is a little sticky, so in real life, I would have had more and it just kind of scrub this line a little bit more, okay? But once you deem your line clean, right, you set it and let it dry, okay? And then I toss this in the trash. Questions so far? Okay.
In real life scenario, we have stitches, right?
Yes. We do have stitches.
How often should we do the dressing?
Facility based, so either when it's saturated or typically when you hit the 7-day mark.
And for IV,
We don't really change them unless they're like, dirty or anything. Our patients don't stay in the hospital long enough here. 3 to 4 days is the average stay for a U.S. patient, okay? So we typically don't change them out too much. But if they are staying for a long time, it's typically 7 days. So my line is clean, really no use for this. Again, I'm still sterile, right? Because I use the gauze to protect myself, right? Like you mentioned, this would be sutured, or you guys see this is a stat lock. It closes around the wings, right? So you put this on, like, if I had to do this now, just like I did the bio patch, I would have dropped it into my sterile field, right? Take it out of the little packaging and take off the little adhesive cover, and I would pick up my line where it is clean and place my stat lock, okay? And then there's little prongs that stick in between the holes. Once I get that in my wings, I just close this, and now it's stable, okay? So we are transitioning away from sutures to more of a stat lock procedure, okay? Again, since it's a newer practice, you won't see it in your packaging, so that's something you're gonna have to get that's extra, okay? But you may see either or, okay? So this wouldn't move as much while we're cleaning, so sorry. So now, what's next? Bio patch, technically, right? In the video, you're gonna see something called skin prep, okay? Skin prep is not a cleaning solution. Because I may ask you, what's the skin prep for? You're like, it's to clean the skin. And I'm gonna say, no, it's not. The skin prep. So the skin prep will come in your packaging, and it's gonna look like an alcohol swab, right? It comes in the same packaging. You're gonna open it up, right? It's gonna be saturated just like an alcohol wipe. And I'm gonna demonstrate just with this. You would take that wipe, right? And remember, it's a wipe. We don't scrub. We just take the sterile part that we've cleaned, and you're gonna wipe where the tegaderm touches, okay? That's what skin prep is for. It's to make sure that your tegaderm, your transparent dressing, seals well, but also, and more importantly, when you take these dressings off, it's the dried layer of skin prep that's coming off and not their skin. Okay, so it's a skin barrier and also an adhesive. Okay, so that's what you're gonna see in a video. Okay, they don't make the training kits with those, but when you see that stuff, that's what that's for. So if you wanna demonstrate that, you can just take one of these extra gauzes and you can demonstrate with that. But again, it's not for cleaning, it's just a protective layer, okay? So I've done my skin prep. I'm gonna toss it in there, okay? Now I can do my bio patch. White skin, okay? And it's gonna sit just like that, okay? I'm gonna take my tegaderm, I'm gonna open it and place it over here. Now, for those of you that don't want to use the gauze or you forget to use the gauze, this is where you get kind of stiff, right? Because if this is unsterile, you get to the very end and you're like, that's breaking sterility. If that happens, that's okay. What you can do is take one of the extra gauzes, right? Be very careful. And again, you contaminated one side, but this side is still sterile. And you would take that to open this one. Or if you so happen just to use everything, this is already unsterile, you can come underneath and open it, okay? If you've broken sterility. That's what I'm looking for. If you broke sterility, how do you fix it? Without, your favorite answer is, I'm gonna call for help, or I'm gonna have a new set of gloves, which is true, but I need you guys to think through, because you're gonna be super busy. To stop this procedure, to go run and get some gloves from the supply room that's all the way down the hall, to come back is arduous. I need you guys to think on your feet and fix the problem while you're at the bedside, okay? So, however you need to do it, I want this open sterilely, okay? So when you open it sterilely, you don't need that, right? Whatever side you take this off of is the sticky side, guys, because I see a lot of touching on this side, it's sticky. Don't do that. When you peel it off, that side is the sticky side. The notch needs to go towards the line, okay? Remember, tegaderms are for insertion sites, not lines, so I don't need to see this. Okay, and again, remember your cap is unclean anyways, right? And this is self-sealed system. It doesn't need to be protected, but your insertion site does, okay? So you can adjust your line however you need to. Like if you wanted to hang here, that's fine. If you wanted to hang up here, that's fine. But I don't want to see the curling, it's not necessary, okay? So I have my notch, I see that here. Directly in the middle is what I want to see, okay? It's looking pretty good today. Alright, got my good seal. Oftentimes with this part, you guys have the tegaderm too high on one side or the other, okay? I'm looking for directly in the middle. Again, you want as much area protecting the space as possible. So if I have my tegaderm all the way down here, that's just all the more reason why it's easier for infection to, or germs to kind of get through this way. So you want it protected. Now, just like we did with the other part, your initials and the date, and then you put it on the dressing. Not on the line, not on the neck, but on the dressing, okay? So once I take that off, put that long ways. All done. Okay. What are your questions?
If the patient is heavily sweating, in that case, the tape will often come out.
Mhm.
In such case, what will we do?
You're gonna do a lot more dressing changes. The skin prep should help with sweaty patients. If you don't use skin prep, you're gonna be changing it probably every other day. They sweat a lot. Skin prep buys you another day. So instead of every other day, maybe every 2 to 3 days. But that's just me. You have to do a lot more dressing changes, which puts them at increased risk for infection still, because we're constantly re-exposing the site, right? So that would take some clinical thinking about, okay, why is he sweating so much? Are we in pain? Are we septic? Kind of got to dig a little bit deeper. Some people are just naturally sweating, but with the drugs that we give them, especially if they're critical, they dry out actually. So if they're sweating profusely, then you might want to try to figure out why they're sweating so much.
Back home, we used to do 3 or 4 times.
3 or 4 times per shift?
Yeah,
Oh,
if the patient
Lord.
sweats heavily.
I love turn up the air in the room or something. I don't know, but that's a lot. You should be doing it that much. Again, if you're changing and dressing that much, you need to get with the doctor and say we're missing something. They shouldn't be sweating so much. Very few people are that sweaty in an air-conditioned place. All of our hospitals are air-conditioned. Every patient has their own room with their own air conditioning module. So if it's too hot in the room, just turn it up. Oh, I'm cold. Give them a blanket. But if they're sweating that much, you gotta think a little bit more.
And to do that by pads, we'll absorb all the, if the patient is bleeding from that insertion site.
If they're bleeding a lot, like if the suture's tore, then the doc has to come at the bedside and fix that, right? If they're bleeding from the actual insertion site, again, that's an MD problem, right? Because there's nothing you can do to fix that, but it has to be addressed. So what I would do in real life, these packets come with this gauze and a lot of them, and you would stack this either over or under the tegaderm, okay? If it's a quick fix, like they're really bleeding, put it under the bio patch. Don't put it over, just put it under the bio patch and just like pack it like a pressure wound and get the MD at the bedside. A lot of hospitals, you're gonna have either a little walkie-talkie or a cell phone to call for help. So use that device to say, hey, come to the bedside. Like, don't leave that patient, pack it, and then have them come address it. We put this in at the bedside typically, so they can fix it at the bedside.